much on. I know.
Ladies and gentlemen, thank you for standing by. Welcome to the LA County COVID-19 update. During the call, the phones are in a listen-only mode, and there will be an opportunity for a question and answer session. At this time, I'll turn the conference over to our host, Supervisor Catherine Barger. Please go ahead.
Thank you. Hello and good afternoon. Thank you for joining us for today's press briefing. I'm Supervisor Catherine Barger, Chair of the Los Angeles County Board of Supervisors. The summer solstice on Saturday marked the official start of summer. The beginning of the season is unlike any we've experienced in recent memory. Spending the break with children home and making plans for weekend outings and vacations are different now more than ever. As we continue to safely open the region, there are plenty of activities to make the most of the summer while staying healthy and slowing the spread of COVID-19. Beaches, parks, and hiking trails reopened last month and provide a wonderful excursion for families. Taking an online tour of museums and galleries here in Los Angeles County and around the world provide a great staycation activity from the comfort of your own home. Libraries have developed creative ways to encourage summer reading through digital reading programs and curbside book pickups. The LA County's Department of Parks and Recreation offers online recreational activities and classes to keep residents of all ages engaged. This is also a good time to think about your neighbors. We continue to see a tremendous increase in the need for food drives to support those impacted by COVID-19. The LA Regional Food Bank, in coordination with the LA County Office of Emergency Management, continues to host food distribution events throughout the entire county, including 2 upcoming in the East San Gabriel Valley and Sunland Tujunga. The Department of Workforce Development, Aging and Community Services distributed nearly 500,000 pounds of food through its community and senior centers. For information about food programs or to find out how you can volunteer or donate, please visit our website at covid19.lacounty.gov. The Los Angeles Community Development Authority has provided $450,000 to small businesses in the 5th District alone, and more than $2 million worth in countywide businesses throughout its Small Business Recovery Loan Program. We are working diligently to support small businesses wherever we can. We recognize that every person in LA County has diverse needs. It is so important for everyone to complete the census so our communities receive resources that they deserve. Many of the programs and services that directly impact the well-being and quality of life of our communities are based on the census data. Everyone must be counted, regardless of their age, race, or immigration status. The census is completely private, and under current census laws, responses are confidential and can only be used by government to produce statistics. In 2020, Census Outreach has looked very different. The Safer at Home orders have meant that there aren't any door-to-door visits or events. To compensate for these challenges, the county has made a concerted effort to reach hard-to-count populations with creative communication, including local news, mailers, social media, and advertising in grocery stores. We are using data to guide our outreach to make sure residents stand up, lend their voice, and most importantly, are counted. For information on the census, please visit my2020census.gov. Again, my2020census.gov. And with that, I would like to turn it over to Dr. Barbara Ferrer, who will give you our daily numbers. Thank you.
Good afternoon, everyone, and thank you, Supervisor Barger, and to the entire Board of Supervisors. I'm proud to be part of the LA County team, and I'm grateful for your leadership every day. To update you on our current status, I'm sad to report 18 additional people have died from COVID-19. 13 of the people who passed away are over the age of 65, and 9 of the people over the age of 65 who passed away had underlying health conditions. 4 people who died are between the ages of 41 and 65, and all 4 of the people in this age group had underlying health conditions. Information on the 1 death reported by the City of Pasadena is available at thecityofpasadena.net. Of the 17 newly reported deaths today, excluding the 1 death reported by Pasadena, 5, or 29%, were among people residing in our skilled nursing facilities. This brings the total number of deaths to 3,137. We're thinking of all of the families that are experiencing the sorrow of losing a loved one to COVID-19. You're in our thoughts and prayers every day. For the 2,918 people who have passed away where race and ethnicity has been identified, 42% are Latino Latinx, 29% are white, 17% are Asian, 11% are Black, African American, slightly less than 1% are Native Hawaiian or Pacific Islander, and 1% identified with another race or ethnicity. 94% of the people who have died from COVID-19 had underlying health conditions. And because this number has stayed consistent throughout the pandemic, we urge everyone who has an underlying health condition to remain home as much as possible, even though there's a lot of reopening that's happening around us. Today, we're reporting 2,571 new cases. And I want to note that this is our 3rd day in the past week where we're reporting over 2,000 new cases during a single day. And while some of this may be due to lags in reporting, the numbers do tell us that we're seeing an increase in community transmission. Although the cumulative positivity rate remains constant at 8%, our current daily rate of positivity, which we calculate by using a 7-day average of the daily positivity rate, is 8.4%. And this is an increase over the positivity rate that we were seeing the last few weeks. For comparison, our 7-day average of the daily positivity rate was 5.8% on June 12th, and that was just 10 days ago. Throughout our recovery journey, we have said it's likely that the number of cases will increase as more people are out of their homes and around other people. Now it's going to be very important to watch how this increase in cases translates into our daily hospitalizations over the next few weeks. There are currently 1,453 people who have confirmed cases of COVID-19 and are hospitalized. 28% of these people are in the ICU, and 19% of the people in the hospital are on ventilators. And while these numbers continue to hold steady, it's a good time to remind ourselves that if you've been exposed or you have tested positive for COVID-19 or you're waiting for your test results, please self-isolate and stay away from other people, even those who live with you in your household. And if you've been out of your home and in crowded spaces, please stay away from anyone in your life who is older or has underlying health conditions as much as it's possible. If an older person or a person with underlying health conditions is in your household, we recommend that you wear a face covering and stay at least 6 feet away from them at all times. Today's reported cases brings the total number of people who have tested positive for COVID-19 in LA County to 85,942. The 85,942 total cases we're reporting include 2,982 total cases reported by the City of Long Beach and 1,162 total cases reported by the City of Pasadena. Both cities have independent health departments. We're also reporting among the positive cases, there are 571 confirmed cases among people who are experiencing homelessness. 231 people were sheltered, and they're now appropriately isolated, and their close contacts are quarantined. We have investigated a total of 682 residential congregate settings and non-residential settings with at least one confirmed or suspect case of COVID-19. Currently, there's 540 ongoing investigations, and there are 142 closed investigations. And as a reminder, we close an investigation when we have no new cases over a 14-day period. These settings include nursing homes, assisted living facilities, shelters, treatment centers, supportive living, correctional facilities, workplaces, food and retail, and educational settings. The total number of confirmed cases in institutional settings is 17,736, and this includes 11,201 residents and 6,535 staff. This is 21% of all of our cases. And I'm sad to report that 1,650 people who were living in institutional settings have died from COVID-19. 1,504 of the people who lived in institutional settings and passed away resided in skilled nursing facilities. And our deepest sympathies go to all who are mourning the passing of loved ones who resided in an institutional setting. We're so sorry for your loss. We're also reporting 1,075 confirmed cases at some point in the jail facilities. 790 are among people who are incarcerated as reported by the Sheriff's Department, and there are 285 staff. There's 178 cases in the state prison, 128 are among people who are incarcerated, and 50 are among staff. And there are 760 cases in the federal prison facilities, 744 among people who are incarcerated, and 16 among staff. There are now 43 cases in the juvenile facilities, 21 among youth, and 22 among staff. And we're sad to report an additional death at the Terminal Island Federal Correctional Institution, and this does bring the total number of deaths at this facility to 10 people. And to the family and friends of the person who passed away, we wish you healing and peace during this very sad time. You can find information on confirmed and suspect cases in these facilities, as well as our dashboard with testing case and death data, and our recovery dashboard on our website, publichealth.lacounty.gov. The LA County Sheriff Department is reporting 367 positive cases among staff. 307 staff are currently quarantined. 1,867 staff have returned to work. The LA County Fire Department is reporting that 650 staff members have been tested for COVID-19, 40 tested positive, 18 are isolated at home, 33 have returned to work, and 7 are home sick. I want to thank Sheriff Villanueva and Chief Osby for sharing these updates each day. As important as it is to mark the increase in the number of cases, it's also important to note how many people have been tested in our county. Over 960,000 COVID-19 test results for individuals have been reported to the LA County Department of Public Health. And again, as I noted earlier, 8% of the total number of people tested were positive. As a reminder, you can continue to make appointments at the regional testing sites by going to covid19.lacounty.gov/testing. Today, I'd like to also provide an update on COVID-19 cases and deaths among healthcare workers. As I've mentioned before, these numbers that I report include healthcare workers who work in LA County, even though they may live in other jurisdictions. There's a total of 7,095 healthcare workers and first responders with confirmed cases of COVID-19 in LA County. This is an additional 534 new cases since we reported last week, and it comprises 8% of our total cases. Cases have been identified among 28 different occupational settings, and the vast majority of cases continue to be among healthcare workers from skilled nursing facilities and hospitals. Skilled nursing facilities account for 42% of the cases, and hospitals account for an additional 25% of the cases. Additional facilities that reported positive cases included outpatient facilities, correctional facilities, home health, and first responders. Nurses continue to account for the majority of positive cases, 43%, although there are cases identified among the range of occupational roles. This includes caregivers, people who work in administration, medical assistants, and people who work in environmental services and food services. The source of exposure is known for 50% of healthcare workers who tested positive for COVID-19. And 78% of the healthcare workers with a known exposure were exposed in a healthcare facility, either by a patient or by a coworker. 6% of healthcare workers have been hospitalized at some point for COVID-19. And I'm really sad to report that 52 healthcare workers have passed away from COVID-19. This is 8 additional people since our report last week. 39 of the healthcare workers who died worked in skilled nursing or assisted living facilities. 6 people who passed away worked in hospitals. 3 people worked in home health. 1 person worked in correctional health. 1 person in correctional facility. 1 person worked in a laboratory. And 1 person who died worked in an outpatient facility. And there still is 1 healthcare worker that passed away where their workplace setting has not been specified. 24 of the healthcare workers who died identified as Asian. 20 of the people who passed away were Latino, Latinx. 3 people who passed away were African American. 4 people who died were white. And there's 1 person who passed away for whom their race and ethnicity has not been specified. We are grieving with all of you who have lost a loved one or a friend who is a healthcare worker to COVID-19. Words cannot express the gratitude we feel for your loved ones and for their dedication to caring for others. And for all of the healthcare workers who are so committed to caring for the residents in our community, I thank you from the bottom of my heart. Since early April, the University of Southern California's Dornsife Center for Economic and Social Research has been collecting weekly data among residents in LA County about self-reported behaviors, experiences, and opinions. And today, I just wanted to share with you a little bit from their research. And I do want to thank the researchers at USC for providing us with the data so that we can better understand how LA County residents are responding to the pandemic. Please advance slide 1. This graph shows by week the percent of LA County residents who report experiencing fever, cough, or shortness of breath over their past 7 days. And as you can see, the number was higher immediately following the Safer at Home order, and then it declined sharply as people were in their homes and only essential businesses were open. Now, as more businesses have reopened, we're beginning to see this rate increase slightly. Advance the slide. This graph shows the percent by week of residents who remained at home except for going out for essential services or exercise. And we see extraordinarily high compliance with the Safer at Home order in April, with that decreasing as the order was relaxed and businesses and spaces began reopening. But even during this first full week of June, we still see that over half of the respondents to the survey continue to stay at home except for participating in essential activities. Our hope is that as we continue to see significant numbers of cases among our county residents, that people will continue to make sure that they are staying home as much as possible to avoid an exposure or exposing others. This is particularly true for those with underlying health conditions and those who are older. Take the next slide. This graph shows the percent by week of residents who have had close contact with people from outside of their household in the last 7 days. And it does demonstrate, again, high compliance with Safer at Home and the practice of physical distancing. And even in recent weeks, with many people back to work, about half of the respondents are still able to avoid close contact with people who do not live in their households. Next slide. This slide shows the percent of residents by week who were concerned about running out of food because of money or other resources in the past 7 days. In early April, 30% of residents had concerns over food security. This number has decreased to under 10% as people have returned to work, but the number is still of concern. And since the county has resources that are available to help, we ask people to either contact 211 by phone or at 211la.org if you're facing any issues of food insecurity. They would be happy to help connect you to resources. As the case counts continue to climb in LA County, we're experiencing, as you saw today, more community transmission. And 40% of the cases are among individuals between the ages of 18 and 40. So while many of us are done with this virus, unfortunately, this virus is not done with us. And it's so important for businesses and individuals to share in the responsibility of successful reopenings. Businesses are asked to closely follow directives, and individuals are asked to make sure they're practicing social distancing, wearing a cloth face covering, and generally looking out for each other. Please keep making slowing the spread of COVID-19 one of the many things you do throughout the day. Now I want to introduce Dr. Christina Galley, the Director of the Department of Health Services.
Hi, good afternoon. Today, I will give a brief update on the hospital bed demand projection model. I will also provide some new estimates on the number of people across Los Angeles County that are likely infected with and are at risk of spreading the virus to others. This information is part of our ongoing effort to make sure that those who live within Los Angeles County have access to the information that they need to help them make good choices about their behaviors as we all begin to venture back into our communities. In order for us to get back to our normal lives and to do so safely with the virus continuing to be among us, it is about our personal responsibilities and risk reduction behaviors that we all need to take. We all need to understand that even as the health officer orders are progressively loosened, almost all of us are still susceptible to being infected with COVID-19, with the virus that causes COVID-19. But our actions are very powerful. If we keep this in mind and align our behaviors with the knowledge about how the virus is transmitted, we can go a long way to helping prevent that transmission to others. First, just briefly on the hospital demand model. As always, the slides are available in English and Spanish on the DHS website. The number of new cases of COVID-19 requiring care in our hospitals each day remains constant and has been constant now for several weeks. In terms of the hospital system, the number of hospital beds and the number of ventilators in Los Angeles County appears to be adequate to meet the projected demand for those services for caring for COVID-19 patients over the next 4 weeks. The number of ICU beds is somewhat more limited. In part, this is because of our increased need to take care of patients who are showing up for care who have conditions and illnesses and injuries other than COVID-19. And because of this increased demand for services among these non-COVID-19 patients, as well as other factors, the number of available ICU beds could become inadequate if the transmission increases substantially in the future. This week's estimate for R, that effective transmission rate, is being reported at slightly under 1. Specifically, the model is now calculating it as 0.94 with a range of uncertainty of 0.83 to 1.03. I do want to make one important mention just in terms of understanding how R is being reported, since there's a slight difference in how we are reporting it from the model versus how we've reported it in previous weeks. The slight decrease in R today versus what we've shared with you previously reflects a change in how the model is being used to estimate that effective transmission number. Specifically, the R that is being reported out now includes an adjustment down, a slight adjustment down, to take into account those who are already presumed to be immune due to prior infection with the virus. We made this change so that our model output is consistent and thus directly comparable with how other communities and models report R. Finally, please remember that there is a lag in the data and what it tells us about viral transmission. In looking at how many people are in the hospital today, those who need hospital-level care, recall that those people were exposed and began incubating the virus many weeks ago, long before they needed to be hospitalized. This lag is always there. It's because of the epidemiology of the virus and the incubation period that can be as long as 14 days, and it's because of the nature of how the virus affects the body and how the symptoms build up over time to ultimately needing to be cared for within the hospital. This is why the bands of uncertainty on the slides account for a possible increase over time, and why this trend in hospitalization among COVID-19 patients is different than the upward tick in cases that was reported by Dr. Ferrer just a few minutes ago. As part of our effort to help continue and help Angelenos understand the need for individual measures like face coverings to reduce their risk, there's also a new number that I want to share today. This is also from the model, and the model suggests that about 1 in 400 Los Angeles County residents are currently infectious. But given the uncertainty inherent in the model, that number could be anywhere from 1 to 200 up to 1 in 700 individuals. This number reflects only the estimated number of individuals who are actively infecting others. It does not, therefore, include those who are known to be infected but are isolated. That would include people who are in the hospital or people who are under isolation at home. Many of these infectious individuals are pre-symptomatic, meaning they don't have symptoms yet but will develop symptoms in the next couple of days, or they are asymptomatic and will remain so throughout the course of their infection. They'll never develop symptoms. As we've learned from COVID, individuals can spread this virus even if they don't have symptoms, and even if they have only mild symptoms. It's lurking even though we can't see or observe its presence. What this means is that Angelenos, over the course of a typical day, are likely going to interact with a number of people who are potentially infectious. Picture just your typical day. You'll be around others at stores or parks, restaurant, bars, anywhere you might go. These people might not look sick or seem sick in any way. If 1 in 400 people are infected and don't necessarily know it and are able to transmit COVID-19, it's entirely possible, or even likely, as the Safer at Home health officer orders are pared back, that an average person in the average day may come in the vicinity of others who are infectious. Now, the determination of whether the virus could actually be transmitted from one person to another depends on a number of things. The characteristics of that encounter matter a great deal. How close you were to the person, how long you were in their proximity, what the nature of the activity was, and what you were doing. But given how likely it is that you could be in contact with 1 or more people throughout your normal day, it's critical to keep using those basic public health interventions and measures that we've talked about so much. Masks and face coverings help you from spreading the virus to others, a virus that you might not know that you have, and it likely protects you as well. This is why you should continue also to physically distance yourself from others whenever you can. It's why it's critical to keep washing your hands and decontaminating and cleaning high-touch surfaces. This is why it's important to quarantine for 14 days if you have a known exposure to a person with COVID or are told by public health contact tracers that you were a close contact of someone with the virus. And because the incubation period of the virus can be up to 14 days, that's why you must quarantine for the full 14 days, regardless of whether or not you chose to be tested, and even if you did get tested, regardless of whether that test was negative. A negative test is not helpful and should not change your behavior. The test is only helpful when it's positive, in that it moves you from someone who needs to quarantine for 14 days to someone that needs to isolate, which has its own timeline, and where you would need to monitor yourself carefully for the escalation of symptoms in communication with your healthcare provider, and alert any contacts that you might have had that they had an exposure. As I shared last week, this is a lot like driving, and we are all on the road to recovery. Every time we get in our cars, we put on our seatbelts, we follow the safety rules like the speed limits and the yield signs. We do that because driving carries with it inherent risks, but it is far less risky with each and every driver when they follow the same proven safety practices. Reopening may have some inherent risks. The virus is still spreading in Los Angeles. but masks and face coverings and other public health interventions and measures can keep you and others safe. It is up to each and every one of us to follow these new rules of the road in Los Angeles County and wear your face covering and your mask, to respect physical distancing wherever you can when you're outside of your home. With that, Nick, I'll turn it over for questions. Thank you.
Thank you. If you would like to ask a question today, you may press 1 and then 0 on your telephone. Again, that's 1, 0 to ask a question. And our first question will come from Colleen Shelby with the Los Angeles Times. Please go ahead.
Hi, thanks for taking the questions. I'm wondering if you can elaborate on the county's decision to decrease the number of briefings from 3 times a week to 1, given the fact that the virus still poses such a large risk. And I'm also wondering, in light of modifications that have been lifted, if the county's identified any clusters of cases that have occurred at gatherings, or if you have any idea if the recent spike has been a result of protests.
Sure, I'll answer the first part, and then I'll let you, Dr. Ferrer, answer the second part. We made a decision to limit it to 1 of these briefings a week, but that does not mean that you're not going to have access to Dr. Ferrer and her staff. We just decided that beginning of the week we would set the tone for what the upcoming days are going to look like, but each and every day Dr. Ferrer will be issuing a press release that will give updated numbers as well as make herself available to answer any questions. But it was just a decision. We got feedback stating that we went from 5 to 3, and we felt that it was time now to limit it to the beginning of the week on Mondays. But again, that doesn't mean that you're not going to get access to information. It's actually going to be without a press briefing like this, but still you will be able to ask questions and get any answers that you need as it relates to the daily test numbers and deaths. So with that, Dr. Ferrer.
Yeah, thanks so much for the question about clusters. So we do have clusters. I mean, as I noted, we have thousands and thousands and thousands of cases. We do contact tracing for everybody who we can reach, and then try to figure out what were the possible sources of exposure, and particularly focused on who else may have been exposed. But what we haven't really been able to do because we have such a high volume of cases coming in is really pinpoint whether or not the exact source of an exposure was a protest. So I do want to say that it's highly likely, given the increased numbers that we're seeing, that some of this is in fact people who may have been in a crowded situation at one of the protests where there was spread. It's also highly likely, as you note when I report that we have over 560 active institutional investigations, that we also have exposures that are happening in workplaces and a whole range of sites where people are coming into close contact with each other. We try to really capture what's going on at workplaces and in institutional settings because those are sites where we know people are in close contact with each other many days, for many, many days. And that's really where we have our best information. But there are, in fact, just like there are everywhere, cases that are resulting from people who may have been at a party together or a dinner together, or they were marching together. That just information is not information we're compiling in a way that we'd be able to share it with others. But thanks a lot, and we'll take the next question.
Next, we have a question from Dave Lopez with Channel 2. Your line is open.
Yes, good afternoon to all three of you. Doctor, one quick follow-up on that. Since you said it was highly likely, can you give us a number or how long this spike will continue? And on a personal level, you may or may not want to expand a little more, but can you give us a little more of your thoughts and why you went public with the death threats against you, please?
Yeah, thanks a lot, Dave. So let me just go to the clusters. So the reason why I say it's highly probable that there have been exposures is whenever there's a crowded situation, and I think Dr. Galley really touched upon this a lot, we have many people who are in fact infected, and many people who are infected without any symptoms. So the more people you're around, and particularly if you're in a crowded situation where people aren't using a cloth face covering, and you're closer than 6 feet, and you're there for a while, if there is an infected person that's nearby, you're likely there's likely to be some transmission. So we really can just look at these situations and say, these are situations where transmission is more likely, and then there are other situations where transmission is less likely. So as we noted before, any kind of crowded situation where people are not using face coverings and they're not keeping their distance increases the risk. And thanks for the second question. I did release a statement today because I have a lot of inquiries that have come in over the last week or so asking me if I received any threats. And, we've been saying no comment, but in fact, in an interview with NPR earlier last week, I was asked that question and I did answer it. And I didn't want to make anybody feel like I wasn't giving everybody access to the same information. I, like hundreds of other public health officials across the country, have in fact received threats and have in fact received a lot of hate mail. For me, it goes back to March. The threats were in the middle of May. But it's not really about me or any one single person. It's really about the fact that public health officials and the team of folks that support us, we're doing the very best we can during a pandemic to try to save lives. And we appreciate how heartbreaking these times have been, and we appreciate how angry many people are. Nonetheless, it's extraordinarily hard to work under conditions where people are so angry with you and take it so personally that they do threaten your well-being and threaten the well-being of other people around you. So we would, and I speak on behalf of the thousands and thousands of public health workers across California and across the nation, we would love for the discourse to shift and for us to really spend our time talking about how together we mark our way through a recovery journey and we all work together to save lives. With that, I'll take the next question.
Thank you. The next question comes from Claudia Persciuta with KNX News Radio.
Thank you. I just want to note that it's important that we be able to ask Barbara for our questions directly and not via email. So I hope that you'll consider bringing back the briefings more regularly. That said, it's been almost 4 weeks since in-store shopping and religious services were allowed to resume, in addition to the mass protests beginning about 4 weeks ago. So now we're seeing significant increases in the number of people hospitalized each day. We've set a couple of one-day records for new cases reported. I'm wondering how this will affect the reopening process going forward. And then a second question, following the New York Times article on people getting kicked out of nursing homes to make way for more lucrative COVID patients, including facilities here in LA County, I'm wondering what you know about such involuntary discharges happening at facilities under public health purview, and what, if anything, is being done about it. Thank you.
Okay. Yeah, no, thanks, Claudia, for both questions. And first, just on the briefings, we do plan to do regular briefings. As there's important information to share, I'm sure that we'll be running at least one additional briefing a week. It'll be more like an availability, which we've done in the past, so that when there's information and we know there's going to be a lot of questions, I, of course, would make myself available, as we try to do regularly anyway. But I do think these are good questions around the reopening. Obviously, we're all looking at the information we get from the data points, and we'll continue to look at that and continue to work both with the state and our board on making sure that we have the very best information and the very best science that we use as we continue the journey on recovery. We have seen a lot of evidence to date that, in fact, many people and many businesses are coming into compliance with the directives. They're doing their very best job, again, to protect both workers and customers, and that is what's most important now. We had always predicted that with the reopening would come new cases. It would be impossible for that not to be happening. What's really important is that we don't see such a spike in new cases that it translates into overwhelming the hospital care system. And that's what we're going to be paying the most attention to. What is happening with that daily census at the hospitals, and how does that then translate into deaths? As you've seen, our trajectory on both remains either flat with hospitalizations, for example, or we're trending down on deaths, which is the only silver lining that we can actually report on deaths, because it's still so heartbreaking to stand here every day and announce that we've had more deaths. But that number is dropping, and we'll continue to pay a lot of attention to that. And then the last question on the involuntary discharges, that's illegal. When it's reported to either the state or to us through a complaint, we immediately do an investigation. There are protocols that every skilled nursing facility has to adhere to in order to do their discharges. So we too are saddened when we hear these horrific stories about people who are inappropriately discharged, because it is illegal and there are protections in place. And there are reporting mechanisms so that our team and the state team can pay particular attention to what's going on. That ought not happen, and when it does happen, we promptly, or the state promptly, does in fact do an investigation. And I know there's time for one more question.
Thank you. That question comes from Josh Pascal with ABC7. Please go ahead.
Yes, Dr. Ferrer, I was hoping that you could elaborate a little bit on the new cases number from today, if you're able to provide any more context, the 2,571. I know that sometimes on Mondays there's a backlog of cases from the weekend, but I'm wondering if that is the case from today, if you can point to a specific backlog from one lab, or any other information you can provide on that high number today.
Yeah, thanks a lot. It's a great question. I wish I could say this was, we had another lab that, dumped 600, 700 new cases today, but it's actually not the case. We always have some labs that are slightly delayed, but that would only account for a few hundred of these cases. So what we really saw today, and I think what we've been seeing all along, is what I would call a real increase that's attributed to, in fact, more community transmission. Thank you, and now we'll take remarks. Oh, now? Spanish. Yeah, okay. Now we'll take remarks in Spanish.
Buenas tardes. Para actualizarlos, nos da tristeza informar que 18 personas adicionales han fallecido por causas de COVID-19. Esto eleva el número total de fallecimientos a 3,137. Para las 2,918 personas que fallecieron donde se identificó la raza y etnicidad, 42% son latinas, 29% son blancas, 17% son asiáticas, 11% son afroamericanas, 1% son nativas de Hawái o de las islas del Pacífico y 1% se identifican con otra raza o etnicidad. 94% de las personas que fallecieron por causas de COVID-19 padecían de condiciones delicadas de salud. Este número se ha mantenido estable a través